I know a lot of people that have come to the UK to work as a care assistant without any degree, experience, or qualification in it. The healthcare assistant job has given those people the opportunity to migrate into the UK, not just by themselves, but also with their family. Even the UK government itself has said that you do not need any formal education whatsoever before you become a healthcare assistant in the UK. That is, it's not a must you go to the university or a school to obtain a degree in health before you can apply for the healthcare assistant job. You do not need to have any experience professionally before you can apply as a healthcare assistant from overseas in the UK. To be honest with you, I've also lost track of those that I know that have come into the UK through this pathway to do the healthcare assistant job. I also know that a lot of you have the greatest desire to come into the UK through the same pathway to work as a healthcare assistant. Okay, so in today's video, I will be discussing with you the hidden secret on how you could come into the UK as a healthcare assistant without any experience whatsoever. Guys, today's video is a very interesting one. So you want to watch this video till the end to know how you could move into the UK through this pathway as a healthcare assistant without any experience. Welcome to the channel, guys. Thank you for tuning in. And if you're coming across my channel for the first time, I'm encouraging you to hit the subscribe button and be part of the family. And I promise you, you won't regret it at all, because I'm on the constant lookout to bring to you updated tips on how you could migrate abroad, and all for free. So make sure you hit the subscribe button, okay? And do not forget to give this video a very big fat like. And as you do so, may God bless you. To be honest, it's not so easy to get the healthcare assistant job from overseas. I mean, the UK care job itself, it's so competitive. About 1 million people are trying to get this care job at the same time, and mostly because it's all for free, right? That is, you are not to pay any dime before you get this care job. I've also noticed that about 90% of those millions of people trying to secure this care job in the UK have no experience whatsoever in what the care job itself entails. Now, for you to stand outside of this crowd, outside of those millions of people, and enable you to get this care job very fast, there is something you need to do differently from others. I mean, you need to do something so unique from this set of people. Even though the UK government has said that you do not need any experience before you can get the healthcare assistant job in the UK. But think about this. How many employers would be willing to recruit people from overseas without any knowledge in the healthcare role? Because these employers invest a lot of money into bringing the candidate, into bringing this applicant in the UK, okay? So if you are a recruiter, would you go the extra miles, investing a lot of money to bring in these people that has nothing or that knows nothing about the care job? Wouldn't that be a very big risk? It's so unlikely for an employer to go that extra miles to bring in people in the UK without no experience in the care role. And most jobs in the UK, you are required to have at least a little knowledge on what the role entails. Now, there's something also called the labor market test. That is, before an employer go outside to recruit people, in this case, recruit overseas applicants, they will firstly check in the UK to see if there is any applicant. It's when there is no applicant willing to do that job in the UK, that is when they go out to recruit people from overseas into the UK to do this care job. Now, if you're an employer, think about this. Would you go through all of this stress? Would you go through all of these things to go and recruit those that knows nothing about this job? I guess the answer is no, right? Even me, if I'm an employer, I wouldn't do so. Now, one thing you need to do differently to set yourself aside from this crowd is to obtain the 15 standard care courses. You need to do the 15 standard care courses. I've talked about these courses previously in one of my videos. I would be leaving the link in the description box so you can go and watch that video and know what it entails. Now, what are these 15 standard care courses? These are like minor little courses you could do to help boost your CV and to give you a little knowledge on what the care job entails. I call them baby courses, right? And you could also do these courses online. That is at the comfort of your home, on your couch, in your bed. You could do these courses. They are 15 in number. You could also obtain these courses for free. That is, most of the websites used to do all of these courses. They do not require you to pay before you obtain these courses. And from my experience, most of these courses are about 30 minutes maximum. That is, within 30 minutes, you could obtain at least one course per day. So even if you are not willing to give in enough time, so much time into obtaining these courses, you could set at least 30 minutes each day for the next 2 weeks to obtain these courses one after the other. Okay, so once you do these courses and put into your CV, your proposed employer would be so eager to call you for an interview. They will say, yes, at least this guy know what this role entails. This guy know what this role is about, because these courses will teach you how to position a patient. These courses will teach you how to move a patient on the wheelchair. These courses will teach you what OIS is all about and the rest. So these courses, they must obtain for you to stand outside of this 1 million of people. From my experience, talking to people, most of these 1 million people trying to get this job have not even started the process in obtaining these courses. So think about this. Would you, as a recruiter, employ such person? And also make sure this courses is CPD approved. There's something called CPD Approved. It's a UK body that approves each courses. Okay, so make sure it is CPD approved. I would be leaving a picture of what it looks like on the screen so you can go and know what it's about. So I'm advising you to screenshot this part of this video. So whatever courses you are doing, you will know that, oh, Clara has said it must be CPD approved. Okay. So doing all of these courses, like I said, would will boost your CV and also change your application game. And even if a website is saying you should pay, my dear, go and pay. It will not take anything from you. For instance, Allison requires you to pay about 10 pounds before you obtain their courses online. You want to get this job, you want to come into the UK. If I were you, I would pay that 10 pounds to obtain those courses. Number two thing that would be a game changer for you is for you to volunteer in any healthcare sector at all, be it the clinic, be it the hospital or a care home in your hometown. Ensure to volunteer. I always talk about volunteer, 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 volunteer. I sing it like a song because I know what I'm saying. Voluntary would actually save you from a lot, not only opting your application game, but also save you from making terrible mistake once you arrive in the UK. The way most of these UK employers sees it, once they employ you, they give you like a week orientation and they just let you be by yourself, thinking that you know what the job is and you can do it all on your own. So once you volunteer for at least 6 months or a year, you would have full knowledge of what this care job is. Like I said, this care job is not easy. You will be given a lot into this care job, so you need to prepare yourself 100% before you even start this application. And talking about voluntary would also give you the advantage of using the clinic or hospital as a referee. Once you're applying for the UK care job, you are always required to provide at least two referees. One must be your past employer or someone that you have worked with under this role. So once you volunteer with this clinic, you could use their company's name, their hospital name as a referee, or even the manager of this company. So you see, it's an added advantage for you. And believe me, this will up your application game from 0% to 100%. Now you know what the care courses is. You've attached that to your CV. You've done the voluntary. You've attached that to your CV. Guys, what would be stopping you from getting this care job? Number three thing that will up your game this year in your job application is for you to have a very good CV. In fact, that should have been the first thing on my list. You need to have a very good CV. I'm talking about a professional CV here. And I've made a video previously on how you could construct a CV with little or no experience in care. You want to check that video? I would also be leaving the link in the description box for you to go and watch. In that video, I gave you details. I gave you a full demo, step-by-step demo on how to create a CV from start to finish without any experience whatsoever in the healthcare job. And if you don't know how to do the CV yourself, or if you don't want to go through that stress or through the time of creating the CV yourself, then you should go and pay a professional to create the CV for you. That should be the only thing you are interested in paying for. I know a lot of people that does this as a side hustle. Most people on my Telegram group, some here on YouTube. You can give them at least £10 to create this CV for you, to make it look standard and professional. However, don't go and lie in that CV for an experience you do not have or for a skill you do not have. Okay? So you need to make a very good CV, guys. I cannot overemphasize. You need to make a very stand out CV before you start applying for this job. Once you implement this in your application this year, this is April, believe me or not, by August, you should be getting called for an interview at least. So guys, these are the 3 tips I said I should come here to share with you guys. I know I've talked about most of them in some of my video, but I think this video is like a reminder for you to know what to do before you start this application. Most of we YouTubers, we don't really talk about how hard this care job is. Okay, and trust me, I know it's so hard. It's so hard getting this job from overseas. That's why you need to do this unique 3 things to stand out completely. And I know most of you must have been frustrated. You've applied for about 10 jobs, you've applied for 50 jobs, 100 jobs, and you've gotten tired. It's also necessary to take a break, pause and take a break. However, also apply aggressively. When I'm talking aggressively, you can take a break for about a week, go back and apply intensively, consistently. Don't give up. This is a game. You don't need to give up. Only the strong will emerge the winner. So apply consistently and follow my channel consistently because I post a lot of jobs here. So guys, I hope this will be like an eye-opener for you to get this care job this year, because believe me or not, I know a lot of people will get this job here. I've been receiving testimonies back to back, and I will keep on receiving testimonies from a lot of you that so much desire to get this job this year. But just do these 3 things, implement these 3 things. If you have further questions on what you could do, ensure to leave it in the comment section. My Instagram DM is wide open. I receive questions, about 100 questions weekly. And I always try as much as I can to reply to those questions because I'm all about trying to help people, right? Now you see I'm all about trying to help people, right? So also help me by giving this video a very big fat like, because that will actually support my channel and keep pushing me to do what I do. See you guys in my next video. My next video, I will be coming back here to show you more about the care courses and also where to volunteer in your home country. Thank you. Bye-bye.